look at the disease model, then there is a tendency for all of us as professionals, but also for lay people out in the community, the public, to attribute the risk factors predominantly to the patient because it's a disease. If we then flip it and say, what if we look at it as a complication? Let's look at the complication model. Now, the minute you look at and frame something as a complication, the risk factors then have to be attributed much more broadly, which includes the patient, of course, but it includes the device, if it's an orthopedic device, the technique, and the clinician. So this is the natural way we would frame something if we regard it as a complication. So peri-implantitis is a disease. What has happened over the last 30 years is because we've regarded it as a disease, the majority of the research and the focus has been on host or patient-related risk factors. And this has been a good thing. It's been a good thing because we now have incredible levels of evidence to look at the risk factors for peri-implantitis as it relates to the host. But we haven't been so good at looking at the risk factors as it relates to other aspects and other potential risks. If we then consider peri-implantitis as a complication, how do we do this? And how do we change this in our mindset? Well, the first thing is, if firm opinion that most cases of peri-implantitis have an iatrogenic etiology, and that was established around the time of the treatment, whether it was the surgery, whether it was the prosthodontics, or whether it was the analysis of the patients and their systemic factors, and so on and so forth. Okay, I'd like to turn my attention to prevalence. And Mia, I'm not going to spend too much on the data because we're going to hear a really eloquent discussion on the prevalence. But at the World Workshop, there was an attempt to have some standardized definition for peri-implantitis. Because we have a crazy situation where if you change the criteria, probing depth measurement by 1 millimeter, you can change the prevalence figures by 3- or 4-fold. Bjarni Pedersen showed this in a paper. Complacent anymore. We simply have to do something about it. And everyone in the room here, you are not the problem because you seek education, you come for these things. But there's a vast majority of our colleagues out there who don't do this. And they're placing implants and they're doing things which, honestly, should not be done. And they should not be allowed to be placing dental implants. So what we need is to change the paradigm. And so I started out with dental implants being a man-made complication. We have to stop thinking of. We now universally need to start a movement where we begin to point the fingers at all those who perpetuate the myth that implantology is easy to do, that anybody can do this. And when a complication arises, we need to point the fingers back at where the complication started, because it almost always will have occurred in and around the time that the implant was placed or restored. Thank you very much for that.